and where their meetings, agendas, and minutes are gonna be posted. So the public knows where to get to be able to be informed. And I believe several of the town board members, like in New York City, and have attended different meetings like this. Did any of them attend the open meeting laws? And if they did, we're not following. The town board doesn't seem, the training didn't seem to take. It might did. So right now, that's about it. I don't believe it would be a legal meeting tonight if we're gonna do it. Thank you.
Normally I wouldn't respond, Gary, but I assure you our attorney has said that the meeting is legal and that we've done everything we need to do.
I wasn't given the agenda until 10 seconds ago, so I couldn't.
Well, I don't know what's going on, but I assume the open meetings law requires certain things. Now, maybe you've got an attorney, now she's not here tonight answering like this, but I assume that you have to follow the open meeting regulations and laws. And apparently, it doesn't seem to be the two laws. You post meetings and agendas in one place. Now you post them in a different one. And that's the only time I've ever seen an agenda in there. The posting of the meeting. It's never been in the legal notices before, at least according to, unless you take them out. And if I did, so. The public would just like to know what's going on. If you want to be open, maybe you'll have your committee. The one you're gonna make up, so we're gonna be able to talk to all the people and they're gonna talk. Maybe that's how you'll disseminate it. Now they'll have to get on the phone and call everybody and say, oh, there's gonna be a town board meeting on Monday night. That way you wouldn't have to post it.
Thank you.
I mean, it's just upsetting that the town board can't settle on just the basics of conducting a meeting.
Okay, for the record, purpose of tonight's meeting is to evaluate a new health care plan prior to the June 1st deadline. Holding this meeting tonight allows the town will save approximately $6,000 through the rest of the year. This is professional services, so it's not included in state law bidding requirements. Beyond that, the town's procurement policy, section 6, specifically says it is not in the town's best interest to require quotes for professional services. With that said, I'll read a resolution here, and whereas the town of Mendon has an opportunity to offer better health insurance benefits to all employees and past employees on Medicare at a substantially lower cost to the town, I make a motion to.
Haven't even. The agenda. So.
Sorry,
Yeah.
I'm sorry.
I move to approve tonight's agenda.
I'm sorry, I skipped that. I'm sorry. Thank you. Second,
I don't know if I want a second. I feel like this special meeting could be seen as disrespectful in that it asks us to make a critical decision for the town when we are not given time to process or analyze the information that was just emailed at 1:15 this afternoon. Where is the transparency? If I was going to make a decision based on the incomplete material and the timeliness of this material provided, I feel like it would be irresponsible and a major disservice to our employees and the community. I requested a side-by-side chart with the comparisons of our current policies with the ones that are proposed to us be provided. So we have them side by side to go through a 38-page document and a 68-page document this afternoon before this meeting. I didn't have time to do that. And it is my understanding that the supervisor would like us to decide if to enter an agreement for this June 1st start date. And with my limited time to research, and given the time for employees to weigh in, there's questions that I have. And I'm glad Nick's here to answer some of these questions, but I do have a list of questions.
that was the point of having Nick here, so you could hear it straight from the source. we've had 2 meetings with Nick and his company. We've had representation from 4 and 5 people from the town to hear his presentation. And it was unanimous that we should move forward with this and bring it to the board.
Has any of the retirees been even brought up on this? Because I talked to a few of them, they had no idea what's going on. Same thing with the employees. They should all be in one room when he gives a spiel. They should all be there. This is under the carpet, is unbelievable.
Okay, well, what I was looking to do is get it approved and then bring employees in to hear about the plan. That's-
So I'm not comfortable approving a resolution tonight.
Either, like tape.
And well, it's substantial savings for the town, and that was why I tried to push it in under the,
Could I recommend we open the meeting, approve the agenda, approve it so that we can discuss it? Agreed. Would certainly appreciate the opportunity to discuss it while Nick is here. We can't do that if we're not in a meeting.
I would agree with that. So I will second the approval of the agenda.
Thank you.
okay, time for discussion.
Got a vote?
I'm sorry,
All in favor?
all in favor?
I,
Aye.
Any opposed? So moved. Okay, so now, Nick, if you wouldn't mind coming up.
Thank you, everybody. I do appreciate the opportunity to speak tonight. Happy to answer all questions, of course. My name is Nick Sablanco. I work with Brown and Brown Insurance. Our office is right downtown, 45 East Avenue. And I'm part of the employee benefits division, one of the consultants on the team. As the supervisor had mentioned, we did have several meetings for this, and both the material that you're being shown is what was shown during those meetings. Tried to strip it down to get straight to the point of how this can benefit the town, and happy to talk about our experience with other towns and villages and how that might apply going forward for the town of Mendon. So if you'd like, we'll open up the presentation. I'll go through that first, keep it pretty high level, and then happy to answer questions either as we go along or at the end, whatever you prefer. We're going to start off right with the Medicare Advantage side of things. So as I mentioned, we do work with a number of towns and villages around here in Monroe County in Western New York. You can see right on page 4, we have a consortium for Medicare Advantage, and it is called, it's one of the 2 programs that we have for the Finger Lakes Municipal Health Insurance Trust. You'll see that notated as FLMHIT at the top of the presentation. What you're seeing on page 4 are the current entities that are part of the Medicare Advantage Consortium. This program is currently with Excellus Blue Cross Blue Shield, which is who the current coverage is with for the town of Mendon retirees. You will see your current plan for the retirees of the town of Mendon on page 5. So the point was made that the retirees have not been notified. One thing I would mention to all of you is that the plans that we're going to show are a significant improvement in benefit, and I'll explain and illustrate that compared to the plan that you have today. And then, as the supervisor mentioned, there is a savings potential. So the reason that we're able to do that is when we create a consortium, a larger buyers group, really that's what insurance is all about, is pooling together. Sharing risk with others is going to help with mitigating volatility in claims costs, helping with keeping costs down for those on the plan. But it also allows us to customize benefits inside this consortium. And you'll see later in the appendix, if you'd like to look ahead, there are 12 plans that we offer in the consortium. What we did is we picked a couple of plans that were either similar in some ways or significantly improved, but also provided a savings opportunity to the town of Mendon. So again, your current plan, or excuse me, the retiree's current plan is on page 5. A couple things I want to point out before we go ahead. This is what we call a shelf plan in the insurance industry, basically saying that you as the entity or the group, you're picking a plan off the shelf. You can't change the benefits or customize them in any way. And there are a couple of areas where we're able to improve right off the bat. At the top, you will know where it says network. This network is an HMO network. Just curious, everybody familiar with an HMO network versus a PPO network? Okay. So that's one thing that will improve immediately right off the bat. In the FLMHIT consortium, we created what is called a passive PPO plan. Essentially, if the doctor your retiree is seeing accepts original Medicare Parts A and B, doesn't matter if they accept Blue Cross Blue Shield or not, it is treated as an in-network plan. We assist with that education as well. So we're not leaving your retirees arguing with the clerk at the desk of whether or not to accept the insurance. We'll make that process easier, but this really helps, especially for folks that consider snowbirds, head down to Florida. Maybe they head to different parts of the country where the network could be an issue. On your current plan, it is a referral-based program, so you have to have a primary care doctor refer you to a specialist and so on. But it's a limited network that Excellus provides. It is not the same national passive PPO that we have, so it's improvement off the bat there. The other things you're going to see, and I'm not going to go line by line from here, but the other things you're going to see are lower co-pays, lower deductibles, just improvements across the board in terms of the out-of-pocket costs that impact your retirees. Today, when they go to the doctor, they're paying $20 to see their primary care doctor or $30 to see a specialist. Ambulance visits, $65, so on and so forth. So while they have the plan provided by the town, and perhaps there's a cost share in the premium, there's also costs when they go to the doctor. So keep that in mind as we look at the plan as well. Currently, as you can see on page 5, you have 6 who are enrolled in the plan offered today, and you can see the monthly premium there currently $533.9 is the monthly premium. So as we flip over to page 6, we like to try to keep it simple. We have your current plan on the left, and then on the right are the 2 options that we picked. We don't have very creative names for the plans. They're called Plan 3 and Plan 8 out of the 12 that we offer. But we highlighted some areas in green where you can see it's a benefit improvement. And then anything that we felt like was a match in the benefit, or at least pretty close, that's just left plain white, not filled in. So as you can see, feel free to go ahead line by line, but you can see it is an improvement in terms of out-of-pocket costs for the retirees on the limited Medicare Advantage plans. Down below in the bottom half, you're going to see the comparisons in the monthly rate, your current rate on the left-hand side, and then the 2 different rates for the 2 different plans on the right-hand side. You can see they are pretty significantly lower. The Plan 3 would be about a 27% savings, and then Plan 8 would be a 32% savings. Just want to pause there. Any questions so far on the plan comparisons and the rate comparisons?
Is there any out-of-network coverage?
So that's the nature of the passive PPO, is that, yes, there is out-of-network coverage on the plan, but really the passive PPO network should tackle most of that. Again, if your member is seeing a doctor that accepts original Medicare, which hopefully they are, and we can certainly help with the education on that, then it's treated as an in-network plan.
What if they're not?
There is out-of-network coverage on the plan, yes.
Do we have a copy of what that is?
You're going to see, so if you see down below where it says medical out-of-pocket maximum, it's a combined in and out-of-network benefit. So a little bit different where you can see, let's see, I'll give you a different example. So on your plan, you can see the in-network out-of-pocket maximum $3,400, out-of-pocket, out-of-network max coverage $5,000. You can see the difference in those 2. On our plan, it's a combined benefit. So in and out-of-network claims go towards the same out-of-pocket maximum. Okay, so on page 7, wanted to also let the board know what it looks like to move forward, so that you have that information as well. New groups to the FLMHIT consortium. There's a memorandum of understanding joining the plan mid-year. I should also let you know that the implementation timeline for the plans can be as little as 30 days. So the town could begin realizing those savings rather quickly. The reason for that, typically we have a 60-day turnaround timeline, but with the Excellus plan going from Excellus to Excellus, it's a little bit easier to transition because they already have all the information. But should you choose to move forward, there is a memorandum of understanding that you would sign. I can get you a copy of that, as well as the intermunicipal cooperation agreement to become a part of the FLMHIT consortium. And then there's a one-time entry fee. It's either 5% of savings or $1,000 minimum, which I believe that's roughly where the town amended fall.
So it has to be implemented by June 1st?
No, we just showed you that it can be a 30-day implementation timeline.
Okay.
Again, just simply for the simplicity of the transition. We can really, for the Medicare Advantage side of things, a group can enter that consortium at any time throughout the year.
Okay.
Don't have to wait until the renewal date like you typically do with some other insurances if you wanted to change them. But a group could enter the Medicare Advantage at any time throughout the year.
Thank you.
Yeah,
We would just lose the savings for the month of June if we didn't, if we pushed it back to July.
Yep. Any other questions on the Medicare Advantage before I move forward and talk about our consulting practice on the active side? Okay. Okay, so for the active benefits, wanted to show you just a little bit of what our work might look like. And again, happy to answer long-term questions. One thing I'll say before we dive in though, is that our goal with our employee benefits customers is to provide a longer runway and a longer term strategy. Unfortunately, health insurance, we all know this, is very costly. The cost is going up rather exponentially at this time. I also brought along some market trend reports that I'm happy to leave behind for all of you, just some light reading in the insurance world for it. But it'll explain what's going on. And unfortunately, yes, costs are up pretty significantly. Making decisions on a year-by-year basis is going to be detrimental to any entity, whether a town, village, or a private business. So we really do try to give you a 3 to 5 months or 3 to 5 year strategy if possible. One of the ways that we do that is we use data to drive decision making. And because we work with many of the towns, villages, and municipalities in Western New York, we use benchmark data that we create here locally. And then we also use national and regional benchmark data that's provided by Brown & Brown nationally. So that's one of the best ways to make decisions is to understand what are your competitors doing, right? How can we be competitive in a recruiting and retention atmosphere? Very competitive one too at that when costs are going up so significantly. The other thing I should mention too is that the town of Mendon purchases insurance a little bit differently than some of your larger competitors, so to speak. Is everybody familiar with the community pool as it pertains to health insurance? I can give you a quick overview. I know this. Okay, so in New York State, every group that has less than 100 employees, whether private or public, you're required to purchase, if you have a fully insured plan, you are required to purchase from the community pool. Essentially, each insurance carrier creates a large pool of all the small businesses in their footprint, and they create off-the-shelf plans. These plans that you're looking at today, these are community rated plans or off-the-shelf plans. What that means is you can't make any changes to the plans, so you can't change a copay or a deductible like a larger employer might be able to do. But each year, the carrier is going to make those changes instead. After they file their rates with the state says, hey, you can only increase rates so much. They will also adjust their plan designs to help keep costs down. But essentially what that means is that the benefit is quote unquote getting worse, right? The deductibles are going up, copays are going up, so on and so on. So again, we use benchmark data that we aggregate here locally, regionally, and nationally to help you with decision making. And just wanted to give you a little bit of an example of what that might look like when it comes to just picking new plans first and foremost. What you're seeing on page 9 is there are 3 plans here that are currently offered by the town. You've got the Platinum 2, Gold 5, and the Silver 19. When we took a look at this and we matched that up with benchmark information, we landed on the Gold 17 as potential alternative. There could be some rate relief there, so a little bit of savings for the town. But there's a good reason for that, right? We took a look at the plans, and if you look at the prescription drug coverage specifically, you'll see we highlighted the Gold 17 in green. Well, your current Gold 5 plan for Tier 2 and Tier 3 drugs, it's a 40% or a 50% share of the cost of that medication. One of the biggest drivers of healthcare spend today is specialty medications. Those are medications that are going to fall into those 2 buckets. They're the ones that you see on the news every night, okay, and everybody's dancing and singing and they're really happy. That's because they're really expensive. But putting a 50% co-insurance on a medication like that, that's going to be a strain on the individual that's on that plan. So for us, we take a look at the Gold 17 and we say, well, look, benchmark copays for a prescription drug plan kind of fall in this realm for a gold style plan. And I won't drill too deep on what that means to have a gold style plan. But having a $45 or a $90 copay that's fixed that you can count on in that situation can be seen as a really nice benefit for it. And it just so happens too that there, I believe, was a lesser rate on that Gold 17. But again, just an example of how we might approach the plan design conversation. We would work with the town of Mendon. We come out at the once the renewal rates are released, which is after Labor Day, typically each year. And then we will present multiple options, whether it's with Excellus, MVP, Aetna, Cigna, United. We work with all the major health insurance carriers, and we do check rates and plans for each of them each year. Okay, flipping over to page 10. As I mentioned, we do obviously have our FLMHIT consortium. There is the Medicare Advantage program, but there is also a program for active employees who are towns, villages, municipalities, and authorities in Western New York. But again, please recall that New York state law requires that you have at least 100 employees in order to purchase insurance differently. Okay, so unfortunately, active employee program at the town of Mendon is not eligible for this consortium. I just want to make sure that's clear. And that's New York state law. I've been trying to change that today. Question.
So our active employee, full-time employees, we would qualify for this because we don't have. So you just gave us all this information that.
No, some of the points that I made previously still apply, because what I'm trying to illustrate to you is how we work with small businesses
Okay.
Versus large businesses. Unfortunately, New York state law handcuffs us there, but we can still use all of the data and information that we gather and aggregate, and we can still give that to the town of Mendon. We don't, it's non-identified information, so yes, we'll tell you who's in the consortium, but we're not gonna say, this is how much the town of Brighton contributes, this is how much the town of Henrietta contributes.
Okay.
We're gonna have that information in aggregate. And you can see that on page 11, just a snapshot, one little clip of some of the benchmark information we provide. We benchmark contribution information, HSA contribution, HRA, FSA. We benchmark enrollment information. Where's everybody enrolling in which plan? And we have a full presentation that's provided to all members of the FLMHIT consortium. Okay, so as I mentioned on page 11, this is just a snapshot of one of the benchmarks that we might use. Keeping in mind that yes, the FLMHIT consortium has some customized benefits, but what we are showing here is on the top bar chart here, you can see the types of medical plans that each group is offering. So what we did there is we called out the most comparable metal level for each of the plans that you're seeing there. So a silver plan would be something like a $3,000 high deductible plan, could be up to a $6,000 high deductible. And then a gold plan is going to be something similar to a hybrid plan where you got a mixture of copays and deductibles on the plan. And then your platinum plans are going to be the copay style plans where it's copay what you do. On the bottom, you can see the percent of member enrollment in each of those plans as well in the FLMHIT consortium. Just as an aside, there are over 5,000 covered lives in that FLMHIT consortium. So it's a good data set. What we have seen over time, now this is that the FLMHIT consortium has been in existence for almost 60 years. What we have seen over time through negotiations, education with both union and leadership, is we've seen that shift to high deductibles. And one of the arguments that we would make for the town of Mendon is that there is an opportunity to improve benefits in association with offering high deductible plans. Just a quick note on claims in any given plan, group plan, over 80% of your members are spending less than $5,000 a year in healthcare services. Most of them are relatively healthy, right? The majority of claims come from a very small subset of your population. So what that means to an employee through the proper education and open enrollment support, which I'll get to in a moment, we can teach folks that only go for their annual physical that's covered on every plan, no matter if it's high deductible or not. You have an opportunity to save more, and perhaps even from the town of Mendon to contribute towards that HSA without increasing costs substantially. But you know, at the end of the day, with an HSA, you keep that money. You know, if you don't spend it, if you're got a clean bill of health, you now have an alternate savings account that can go towards retirement, your out-of-pocket costs if necessary, and so on. But it's an added choice. There's a lot that goes into that conversation and a lot of education support in there. But back to the original point, you're going to see in the enrollment that we have almost 60% of our members are now in high deductible plan. When we launched the FLMHIT consortium, I think it was over 85% were in copay plans. So it's been a long time of education and support, but that has happened over time. We've seen folks buying down to plans that make more sense for some of them in many cases.
So
Is there a proposed plan for employees tonight?
Not tonight. No, unfortunately, we don't have that for January first. We won't have that until after Labor Day, because that's when the state finalizes rates, or the carriers finalize them.
Yeah.
What you'll see next is you'll start to see, I believe either in June or July, you're gonna get a notification or a letter from Excellus stating by plan how much they are requesting that rates be raised. And unfortunately, I'm gonna mark that somewhere in the mid-20s this year. If it comes in lower, hallelujah, but that's kind of where we're trending. So they're gonna send that off to the state. They're gonna notify all of their members, hey, this is what we're hoping to get from the state. The state Department of Financial Services is gonna knock them down a few pegs, at least if that's what history tells us. And then after Labor Day, they will officially release the rates. So my goal tonight was to show you how we would consult with the town of Mendon, the types of data that we would use to drive decisions, and just some of our experience that we've already had with many of your peers here, right? Yes, sir.
like next year, this alternate 2026 goal 17 goal.
I think, yes.
Right, would that be something that we are even have an option to use?
I can't tell you that for sure right now. I can tell you historically what rate increases have looked like. If you weren't aware, last year, Excellus plans took about 18 to 20% increase on average. This year, medical trends are slightly higher than they were last year. Medical trend is basically if I were to go yesterday for a service and I go for that same service today, how much did that same service go up in cost? It's about 9.5% this year, whereas last year it was 9%, and the year before that, I think it was somewhere in the 8 to 8.5% range.
No, I mean, is
Historic-
that like only available, could be in the consortium?
No. So the Goal 17 plan, that is a plan that is offered to small businesses by Excellus. Yes. So as long as you are a small business that wants to offer a group health insurance plan in Excellus's footprint, which is basically Batavia to be about Utica or a little east of Utica, and then up north to the Canadian border, down south to Pennsylvania. So if you live in that footprint and you'd like to offer a group health insurance plan, these are some of the plans that you pull off the shelf that you can offer to your.
So what is the actual proposed draft tonight?
To change our broker so that we can offer the Medicare plan for those employees or those retirees or employees that can benefit from that. That will give them more benefits and lower the town's cost by $1,000 a month the next 6 months. So that's what we're looking at here.
So if we were your broker, there are many other services that we provide throughout the year. So I wanted to keep it to some of the consulting services. We have a director of compliance on staff here in Rochester. We provide a suite of compliance services to our members. We provide education and open enrollment support, not just at the time of open enrollment, but throughout the year. I'm always happy to speak to employees, and our team is as well. There's quite a bit more that we provide throughout the year as a broker. I guess I'll just leave it at that.
So, yes,
Hey, Steve,
you may, Mark.
when I was on the board, we were offered source here, and we turned it down. One of the reasons that we turned it down was that there was the amount of municipalities that were engaged in it was limited, so relatively small number. But if I remember correctly, it's going 6 towns, that 6 municipalities that were going to be participating. What I see here is that there are 12 different towns out of 19 counties that are participating. I also see that it appears to be a far more favorable set of circumstances that we can take benefit of. My 2 cents.
So if you accepted this, you're gonna save 6,000. Minus the 1,000 to pay you, so then you're down to 5. And then what?
And then we don't know what the
what
rate
do
is
we
gonna
pay
change
you?
to.
Yeah, and what do we pay now, like? how much do you cost?
Yeah, no,
There's
fair
gotta be a
question. So,
cost.
Yep, yeah, so, every broker that is, assigned with an Excellus or an MVP is paid the same commission, and it's built inside the premium that you pay. So there's a fixed commission percentage, or I'm sorry, a fixed commission per member role that's paid. That's non-negotiable. So it doesn't matter if it's me or your current broker. They can't go back to Excellus and say, hey, we'll save you money by doing this. I wish I could. If we were working with the town and we could self-insure your plan, let's say you had hundreds of employees, our rate would actually be lower. But it's fixed, and unfortunately, that's not something that I can influence. They also, every broker in our community does have access to the same plans. So that's part of why I wanted to speak a little bit about our consulting practice and our approach tonight, because I think we approach it a little bit differently. Sometimes we walk into these situations and you see plans that are just kind of thrown against the wall a little bit. Maybe now there hasn't really been a conversation had about what is the impact in certain scenarios. But again, we use really good data that we aggregate ourselves. Nations.
We finished going through and then I'll ask my questions.
Absolutely. All right. Okay, so on page 12, there are a couple more just benchmarks, snapshots. These are contribution benchmarks. So this is how much is the town or municipality contributing towards the monthly premium of each plan. You can see we broke that down by plan for you. So just a comparison for your reference. No real recommendations just yet, but you can see where you're either in line or out of line with benchmarks here locally. And then down on the bottom on page 13, I already really talked about this a little bit, but I think there's a really big opportunity for the town contributions to an HSA and as well as HSA education. The younger generations of employees really take to the HSA because it gives money in their pocket. It's now in their control. They can save it long term if they'd like. It could be another retirement account. There's investment opportunities with HSAs. You can invest them in mutual funds. And then if you get to retirement and you don't want to spend the money on healthcare expenses, you basically draw that down as income. You wipe away the tax penalty that you would pay pre-65. So they're very flexible accounts. I always joke that if you're an FSA, a flexible spending account, although HSA is more flexible, so it doesn't really make sense how they came up with that term, but it's truly a savings account. And again, we would give contribution benchmarks each year to the town of Bennington. That is the bulk of the presentation that I wanted to show tonight. There is an appendix with a lot more information, but I would leave that behind for you. That just has some information on some of the additional services that we provide. There's some other financial snapshots in there. A little bit more in the weeds, but I want to keep it high level for the board tonight.
Any more questions for me?
Yes, yeah. If we go back to the retirees, I really like the side by side. Is there any additional information? So the estimated total annual premium, is this just what the retiree pays, or is this what?
That's the total premium.
That's the total.
Yep.
And then
Terry doesn't pay.
that's 100% from the town.
Yes,
The
20
premium.
years and over 65.
Thank you.
It's Medicare.
Okay, so it looks like you have the current membership list. That was one of my questions. The eligibility requirements for new municipalities and the minimum employee count or other participation thresholds. So the minimum count was 50.
So on the Medicare Advantage side, there is no minimum. On the active side, currently is 100. 100 full-time equivalents is the actual language. So there's a calculation between your actual full-time employees. You add on hours worked by part-time employees to get to that at 66, which I don't know that number for the town.
Have there been any recent amendments to the trust agreement?
No.
And then do you have a copy of your most recent annual report or the New York State Department of Financial Services filings?
Yeah, we can get that for you. Sure. It would like, you're asking for the Medicare Advantage side?
Yep,
Yep, okay.
that's what we're going,
Sure.
right?
Yep.
And then I think I also would like to hear from the employee input or feedback from the employees if they have any idea. what's happening.
We talked a lot about that at a couple of our meetings, and it is gonna be an educational thing. For Nick and his team to go to the employees and say, which particular plan fits your situation. A 25-year-old single kid might be different than a 30-year-old married guy who has a spouse and kids and stuff like that, so, you know, I think we talked about that as, a lot of it's gonna be education, especially when it gets to the HSA accounts. And, you know, but that's, you know, that's a little bit further down the road, like we talked about, since they can't switch those plans January first. So, you know, so this is, it's kind of a two-step process that we're going through here. You know, we're gonna hit the Medicare subscribers and then the other part of this that we talked about is that it may be beneficial where some people may take a buyout or whatever, or has a spouse that works and their plan is through a school district, through a job at wherever, that it may be beneficial where the people either split up or we may get that employee to come over to the town towns plan, because you know what we're trying to accomplish here. So you know, I think that's what I brought up on the town board meeting, you know, a couple, 3-4 months ago. So, you know, we gotta have something that's aggressive or to, you know, recruit, retain employees, and it's, you know, the healthcare coverage is huge. And I think there's just no doubt about it. And that's what Nick said, is, you know, you're looking at 15 to 20% or more increase in costs for healthcare. It doesn't matter who you are. You know, whether you're, you know, public, private sector, small company, large company. You know, but that's the other thing. I think Nick and his team are kind of looking for a little bit of a commitment out of the town before they invest a lot more time and everything else. So I kind of think that's what we're looking for here too tonight. You know, I sat in on the meetings and we got to do something. We need to move in a positive direction here. So that's kind of.
What does the cooperation agreement look like? What is the length of term? What is the exit? What's that?
I can send you a copy of that.
Okay, thanks.
What are the amounts in the co-pays established?
For the Medicare Advantage.
Yes.
Well, we put together 12 different plans, so we really tried to cover the full gamut of benefit level. I think that's probably the best way to answer the question, honestly. We tried to create a customized benefit spread so that when we're speaking to any municipality or authority, we can hopefully either match or improve their current benefits. As we adjust co-pays or benefit levels, that's where the rates adjust as well. So, but we haven't made any plan changes to the Medicare Advantage consortium. We've added the 12th plan just last year. But aside from that, no changes to the current plans.
So I go back to kind of the disclaimers. Do we know enough as a town to make a transition and make sure there's no enrollment errors or coverage gaps? Because that's the sole
All for it.
responsibility of the customer.
Right.
Do we know enough internally to the town to make sure that everything is covered? Because it's not Brown and Brown that does that.
I can tell you yes. I can provide you with the benefit summaries if that's helpful.
Yeah.
That is the full benefit summary. I know we're showing you a snapshot here tonight.
Mhm.
Happy to provide the full benefit summary so you can look at them side by side. If you want my 2 cents, this is going to be a much more free plan.
I'd like to just, if you have more questions, that's fine. I like to make a statement. You know, in light of the long term, and the increases that we've seen in health insurance. The fact that we had 2 meetings and several phone calls and lengthy phone calls and deep discussion on this. The fact that we're looking to save money for the taxpayers in the town. We're trying to offer better health insurance and stay competitive. Because we're losing employees. So that's, and the savings if we can get this in place by June first, we save that extra $1,000. So I didn't think that was money to blow off. I apologize if I rushed this through. I felt it was in the best interest of the town to push it forward and try to get it going to save the money. So, because every month we're in there, we're saving $1,000. So,
Certainly worth the discussion. Certainly, you know, $1,000 is not, it's not chump change. So really interested in if there's ways to do that. I just want to make sure that we're balancing risk versus savings. It would be really compelling if we had a forecast that says, okay, here's the trends of your current broker, your current plans, here's how they've changed. Here's how our trends have changed. Here's what we've done in the past, and here's what we forecast over the next, so you said a 4 or 5 year time period. That would be really compelling, a really good breakdown of what exactly gets better or worse for retirees, because we're not talking about employees tonight. And then a very clear picture of how does the financial risk picture of Mendon change moving to a consortium versus the existing plan. I think those three things would make a really compelling case for me to say, yeah, this makes a lot of sense. It's savings for the town without an inappropriate change to the risk profile. And I don't know if that's something that we can do. It's not, in my mind, I guess it's not a $6,000 decision. It's a $1,000 decision. If we delay a month, that, again, always want to save $1,000, but also want to make sure that we don't get into a situation where a retiree has an out of network provider that right now they're used to paying 20% of their bill, and that jumps to 80% of their bill, because I'm not completely clear what the out of pocket visit charges are for the consortium plan.
And,
Does that make sense?
and honestly, if we have the $6,000 savings or even $5,000 savings, what's gonna happen in January?
Everybody's health insurance costs are gonna go up.
Right,
What I would say on the individual side is you're more at risk of borrowing group, right? And so think about, one thing that not a lot of people know about is what is the actual cost of a service when you go receive that, right? So if you were to get a knee replacement, shoulder surgery, whatever the case, a lot of folks, they don't even look at the explanation of benefits, right? We're talking about tens of thousands of dollars in many situations. If we have a cancer, premature baby, high cost specialty medications like your, Dupixents and all of those Guardians and that, those are tens of thousands, hundreds of thousands of dollars. So you're going to see more ebbs and swings on an individual basis than a large group. The idea behind the consortium, band together, share in premium, but also share in risk. And so I totally understand. So on the Medicare Advantage plan, I will tell you, we have averaged single digit increases. The only year where we had an anomaly was when federal government made a change to Medicare, and that hit everybody. So aside from that, the program's been strong. I can never guarantee what the number should be. Just like I can't guarantee what Excelis's increases are going to be. I can give you an idea based on my experience, and over the last couple of years, it's been pretty tough. And right now, again, from the information that we're getting from Brown & Brown nationally and some other areas that I pay attention to, medical trends and pharmacy trends are even higher than last year. And that's the idea of getting into a consortium. It's going to insulate you from the swings and the ebbs and flows. That's the idea theoretically.
Does the consortium have an annual true up at the end of the year or payment for incurred but not billed
No, the Medicare Advantage is fully insured program.
for the employee plans? Sorry, I was jumping over to the employee plans.
So for the employee, is there?
Oh, I guess we don't qualify for the consortium for employees, so.
right.
On the active side, well, the answer is still no.
Okay.
Because it's a fully insured program.
Okay.
So essentially the way it acts to the town and the employees is there's a monthly premium that needs to be paid.
Yeah.
Whatever happens, happens. You're not paying any, there's no true up, there's no call to fill cash reserves or claims reserves, if that's what you're referring to. No, we don't have that in either of those consortiums.
Okay, thank you.
Anybody else?
What does the exit look like? So if we sign on in 20 and participate in the with Brown & Brown in 2026 and decide that we want to depart in 2027, what does the exit look like?
shake hands and say thank you for the opportunity. There's no penalty.
We get said you've been in business for 16 years.
The Fleming Consortium, yes.
We see the percentage of increase each year for the last 16 years.
Sure. I don't know that I put that here. I don't have it. Yes, I can. Again, keeping in mind that's for the active employee program that the town is not, but yes, I can definitely show that.
We should have that data.
I can tell you verbally, it's in the survey.
The
You
six,
don't even get this money.
Right.
We're not even qualified.
No, but we know what the
Yeah.
percentage of increase has been year to year for health insurance. The cost of the town. We could compare that with this data.
oh, I see what you're saying. So the percent we've paid each year.
Yeah.
Increase.
Yeah,
For the
on the
retirees.
active side, I'm pretty sure it's in 7 to 8% range, but I can get you the actual figure since inception, how we've been trending. To the question, hopefully that would illustrate our expertise, and how we performed over the years managing a program of that size. The Medicare Advantage Consortium, like I said, we've been averaging in mid to high single digits, somewhere in 5 to 9% range. Except for the 1 year where the Inflation Reduction Act changed Medicare Advantage plans. That was a significant increase across the board to anybody with Medicare Advantage plan. Some is high, but right now, well, there's some other plans out there right now that are facing about 130% increase on their Medicare Advantage.
So would page 15 and 16 be the most accurate forecast of what employees' health insurance would look like? 15 being our current and 16 being, because we don't qualify for the employee consortium, what Brown and Brown may put together for employee healthcare.
Yeah, so this is an
Okay.
example of some of the work that we may do. So here's the one thing I want to caveat by saying is we really didn't drill down into individual union contracts yet, or division contracts just yet. Because as you can see, there's a difference in split in the employee costs for some of these plans. But yes, we did try to just illustrate, hey, based on our experience, if we were to offer these 3 plans with benchmark contributions, so we changed the contribution structure a little bit to get more in line with competitors. This is what it could look like financially. But we also added in an HSA contribution, just playing around with a couple of different scenarios. So this kind of speaks to the argument of why we'd like to start working together sooner rather than later, because there's been multiple conversations. The 2 meetings that we had with the town were over an hour and a half long each. So we like to take our time. We like to do the right thing, and it is a lot of back and forth. It is a lot of conversation with you and hearing from the employees and what's gonna fly, what's not, right? And if it's not gonna work this year, okay, that doesn't mean that it's out the window. That's part of that 3 to 5 year runway, right? So, yeah, it could be a snapshot. I don't want to tell you that this is a final recommendation.
No, understood. Thank you.
Is there any change to dental?
No.
If we were to, let's just say hypothetically, we moved forward from here on, we can't and we won't be making any plan changes in the middle of the year. Everything that we consider would be strategy discussions now, setting up for the renewal when it's released in September, and then going into open enrollment for implementation January 1st. There are programs available. That was kind of the next question. There are dental consortium programs, vision consortium programs, life insurance, voluntary benefits. We really try to create size and leverage regardless of what the insurance coverage is. We do the same thing on the property and casualty side as well. So it's really, that's
Can
kind
we
of
be a part of that?
as
Stuff?
the non-medical, yes. So dental, vision, life, critical illness, accident, hospital indemnity. We do have programs through a couple of different associations. So yes, they would be a potential fit.
Further questions on my end?
Anything, Thomas? Okay,
Did everybody get the email that came in also today from?
thank you.
Yep, thank you very much for the opportunity. It's very nice meeting you.
Thank you for
Thank
coming in
you.
this evening.
Yeah.
So again, if there's a lack of comfort at this level, choose to table it, someone could make that motion. If you'd like to continue with this plan as presented. What's the thinking?
I'd like to table it.
I would too.
I think I would like to like reach out to the retirees.
Yep.
You know, show them what's.
Yep.
Red books,
Yep,
just so everybody's on the same page.
okay, fair enough.
You know, Pete, you said you had meetings with your employees.
Just stating that we were researching different options and stuff like that that would be going forward, so. No, I didn't promise them any changes or any commitments or anything else, I, just pretty much said that this is, research right now and. For options, and then, they could propose some better coverage for less money, but there's also options in there that would help facilitate. So it was,
I thought the biggest complaint was not having the family plan.
that is very big, I think, that for a lot of them, there is, when, it's a child count, whatever it is, it's absolutely free, yeah, but it's, I think there's a lot of people wanna have a family plan. I quote them to have a family. So they can say that we have this coverage, and stuff like that, so.
We can offer a family plan, it's just at what cost?
Right.
So this is a way down the road, looking at January 1 as a goal,
Right.
to offset, to allow these employees to have family plan that they can afford. And has great coverage. So that's down the road. That wasn't really meant for today's discussion, but it certainly is important in terms of understanding what they have to offer. So I think they were great questions, to ask.
And certainly a big discussion that we have to think about for the next 8 years. We have the.
Yeah, we
Medicare
have-
plan that's-
right,
That's within the
right.
next 30 to 60
Right.
days. or whatever.
We have plenty of time on that piece.
We have
Yes.
time to.
Yeah.
Really finalize.
Yeah.
And I think, if we can save $1,000 a month just on the Medicare part, I think there's could be significant savings. To go to active employees, and I think, if you look at, not just the highway department, but, ones in town hall, and there's accounts that there may be advantages. To what we can offer here versus what you get with spouse or other governments. But
That's the
we're gonna-
concern also, right? So if you start saving, or if we start offering a really great plan, that a lot of our people take the opt-out instead, then that'll end up costing the town more in the long run.
Yeah.
If they wanna come on to ours. So that's something.
Right.
So those are numbers we would have to work on and work out and look at the actual numbers for that. We would project how many people might change over. And
Right.
We have 8 people right now, full-time, that would be eligible to take the opt. So if those 8 people said, oh, that's a great plan, I think we'll change,
right,
that's a lot of spending time.
but if we offset the cost through other creative legal
Yeah.
ways, it doesn't really matter. We find ways to offset it, and ultimately, at the end, it costs the town less money. So,
But
Yeah,
it's
that's-
less money per employee versus the whole group, it's not necessarily how much you spend, it's how much you
Yeah.
can save. So,
So it's trying to be
Also-
proactive and looking ahead to what's coming and trying to be proactive. Again, I apologize for pushing it too fast. Obviously, we weren't ready for that, and I apologize for that. I really just, again, had the town's best interest at heart. I was convinced, in the group that met with Nick and Molly were convinced in those long meetings we had that this was a good way to go, and it seemed like a no-brainer, which I think it is, and we can wait a month and it'll still be a no-brainer, I think, for everybody, but it's not for me to decide that. I understand. I just thought that everyone would be convinced at this point. That's what I was thinking. So, well,
It's also a cost benefit to happy employees.
That's true.
we said all along, we just want to save the town money and offer better benefits for the people that are asking for that. So we have to be competitive. So that's where I'm coming from.
So I move to table the resolution.
Is there a second?
A second.
Okay, all in favor?
I
Aye. Any opposed? So moved.
Thank you again for coming in tonight.
Very well.
Yeah, really appreciate it. Okay, any public comment?
I got a couple comments about this. One, I'd like to commend the board for insurance. Block. They have been here. And for, usually it only is, things don't come up like the ambulance contract, fire contract, insurance. Until the backs are against the wall, they have no time. You guys don't have time to look at things. At least you're looking at things ahead of time. Or your backs are against the wall. You have to make a bunch of decisions. But I will commend the board. This insurance deal is good to me. In a longer process than a 2 or 3 day decision to make. In that you have a lot of insurance policy, you've got opt-out policy, you've got, and all these things may change. And the board needs to consider all of this. And how everything interrelates. Question, and I think that what you were talking about before, our current retirees can be able to re-enter the town insurance program. Right now, we opt out, town board's gotta make that decision, it's the town board's. Whether they can get back in or they can't get back in. I was unclear about, for the employees. Will the town pick the metal levels of the plans at the different levels? Or they talked that there was like 12 plans available. Can each employee pick among the 112 plans? I got number 1, I want 3, you know, I'm unsure of what he would think. And I think that's what the employees are concerned with, so. And again, it's just gonna be a much longer process. I think the board needs to look at it, probably needs to make changes. But I think that you need to take a hard look at all your insurance policies. I'll make that, especially how it affect the employees. You may not want to give the opt-out, but you may want to take that money, put it towards, maybe towards family. I agree. Problem, benefits are a problem. The health insurance, all benefits are a problem. Hate that now. They start comparing everybody, he can go here, he can go there, like this. They can go shopping, it's a problem.
Thank you.
Falls on your shoulder. And then, if citizens come, just saying. You make it too lucrative. So, I know Henrietta, my daughter works at Henrietta. And I know they have what appears to be a great insurance, especially at high deductible. And I don't think you can beat that high deductible. I don't know what something like that would cost. Everybody goes to that high deductible. That's I don't know. they've got great policy that the employees like. Don't say about, they do have it.
I didn't hear that. They have what?
They have a union.
Oh. I see Nick smiling. That must mean Henrietta's under your plan.
Yes, I don't understand why we discuss what other.
Well, what a point of order. Let me adjourn the meeting and then you guys can talk all you want. I can make a motion to adjourn the meeting. Have a second? All in favor?
Aye.
Any opposed? So moved. Thank you, everybody.
Thank you.
Thank you for the last minute stuff.